Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. This podcast keeps circling one question. How do you care for communities the system tends to overlook? We've talked about a lot of communities and leaders as well, trying to figure this question out. Usually we get there through history and context, what a community has survived and what it's still going through. Today we come at it through a different lens. Specifically, you cannot care for a community you've never actually listened to, because responsiveness without engagement is, just a well-meaning guess. My two guests know that difference in their bodies. Rebecca went in for routine surgery in 2001 and woke up to ovarian cancer. And to doctors telling her to say her goodbyes. She's still here, a second cancer behind her, 25 years of advocacy since. She says in this podcast, I want to make sure that my suffering didn't mean nothing. Stephanie, our second guest, was a 20-something until a surfboard caught her in the head. She relearned how to talk and walk, lost her job and her insurance, and then pointed all of it back at the system. Medicaid expansion, state legislation, patient leadership. And she says, we want the systems to be better than how we found them. She means it as a job description. Both of them worked on the INSPIRE project. The word INSPIRE stands for Initiating National Strategies for Partnership, Inclusion, and Real Engagement. And it's a roadmap from community catalysts. That middle word, real, is the spine of this conversation. Real, as opposed to the survey you send and call it engagement, the party you throw and call it engagement, the advisory board that meets, nods, and changes nothing. Not that. The roadmap names 9 dimensions that you'll hear in the podcast as well. We walk through where well-meaning organizations keep missing. You'll hear why patients describe this work as giving their time, treasure, and trauma, and why paying people for their expertise isn't a courtesy. You'll hear Stephanie make a case to find your most frustrated patients and hand them a path into advocacy, because the person who's furious about the thing is the one who understands it the most. And you'll hear Rebecca on the 50,000 glossy brochures that you printed that nobody can read, and how much of a difference it makes to have just one plain language page instead. And you'll save money too. Caring about a community and engaging that community are in 2 separate steps. The second is how you do the first. Trust, as Stephanie puts it, is a currency. And when you don't have it, people skip the screening, ignore the guidance, walk out, and don't come back. I asked Rebecca how you last in this work, which seems so hard. One word, relentless. Here's Rebecca and Stephanie and how they remained relentless. Stephanie, Rebecca, welcome to the podcast. Tell me a little bit about yourself.
My name is Rebecca Esparza. I live in Corpus Christi, Texas, here in South Texas. In 2001, I woke up from what was supposed to be a routine surgery to remove fibroid tumors to ovarian cancer. Doctors told me it didn't look good to start putting my affairs in order and saying my goodbyes. But thankfully, by the fall of 2002, I was in remission. And I just decided that what I went through, I felt the calling to help others through their process. And by 2008, I got a second cancer of thyroid cancer. So I've gone through a lot medically, and there's some things that I experienced that I think that others do not need to suffer through. So I'm hoping that others can learn from what I've experienced throughout this entire time.
Thank you.
Sure.
Stephanie?
Yeah, like Rebecca, my own medical journey called me into trying to work towards creating a better healthcare system for those that come behind us. So 10 years ago, I was in a surfing accident and I was hit in the head with a surfboard. So I went from being a very capable and confident 20-something-year-old to laying in a hospital bed and having no idea what day it was or what was really going on. I struggled to learn to talk and walk again. So it shook my world upside down. And I've had a traumatic brain injury that I've been in recovery. And it's a long journey of lots of appointments. And along the way, you can imagine an employer not really knowing if they want to hold an employee that doesn't have the capacity to communicate about really anything. And so I lost my job, my health insurance, had some housing instability along the way, and I've had my brain rehabilitated. Obviously, I can talk again, I can walk again, but I can't drive, and I have a lot of visual damage, and then just some slower processing skills that just make the world a bit different for me, but have been really lucky to find the journey has led me into doing a lot of advocacy and organizing. So I was uninsured for a long time. My state had not expanded Medicaid at that point. So I got involved in my state expanding Medicaid. I'm based here in Salt Lake City, Utah, and have been involved with legislative work at the state level, and have also been a part of, like Rebecca, we partner with healthcare organizations to try and make them understand the people that they serve better, and to make sure that the healthcare systems don't get too far removed from the people that walk more complicated paths and have maybe more complex healthcare needs.
Thank you. I can imagine you've shared your story so much. And I can also imagine it somewhat feeling exhausting to try to do it over and over. And this is the first connection that I have on the Inspire project. And it's called Initiating National Strategies for Partnership, Inclusion, and Real Engagement. It was interesting to have that word real engagement. And I wanted to highlight that specifically because all organizations talk about community engagement, but often they don't actually know how to do it per se. I think that was the premise of this whole report. So what did you think of when you heard that framing and this idea of quote unquote real engagement?
I thought it was refreshing that we go beyond tokenism, beyond having a party and calling it patient engagement, sending a survey and calling it patient engagement. It's much deeper than that. And we as patients want something deeper than that.
Yeah. One of the many commonalities I think Rebecca and I have is that, and we feel this way about all of our peers that do this work with us, you'll always hear that we want the systems to be better than how we found them. And so when we say real engagement, we do mean real, because it's not just about, as Rebecca said, tokenizing. It is about how do we actually shift power and decision-making, and how do we make sure that patient partners are partners and, not just like a check a box or just like a marketing ploy. And I think it is important that it is about that holistic and deeper engagement. And I think real can mean a lot of things, but I think deeper, authentic. And I think that's what we're excited about, because we believe that there can be that shift. Community engagement doesn't have to be something that people just roll their eyes at, but it can be something that is actually transformational and makes a huge difference for both parties involved, the healthcare providers or the healthcare systems or the clinics or whatever, but then also the patients, the people with lived experience that are doing this and are using our lived expertise to contribute to the improvement of the healthcare system.
Yeah. I liked in the report, I think it was about how community engagement is not patient activation. It's not health education. It's almost felt helpful to think about what it's not, because it can mean so many things. And I know part of this report was trying to answer that concrete and practical way. And that's how you came up with the 9 dimensions. So this is all the things it's not. Here are the 9 dimensions. So when you're thinking of the 9 dimensions framework, tell me a little bit more about like how you approach that. I can imagine it's really hard to narrow it down. We don't need to do a deep dive. I can list them too. I have a report here. But tell me just coming up with these 9 dimensions to help people feel like this is what real looks like.
I guess what I would say is a part of it is that we're trying to think about when you see authentic community engagement, what does it include? I think because in order for it to be real, in order for it to be authentic, it's a practice. I think so often too many healthcare organizations who are maybe well-meaning just can't really figure it out. They haven't operationalized it. They have this like value set maybe, They believe in patients having autonomy. They believe in patients being treated with respect, and they hear about why community engagement is good and they're bought in, but they don't really operationalize it. And I think part of what I appreciate about the dimensions is that it is trying to show part of the work that you do. It is top to bottom in the organization. People understand how can their role also be a part of the community engagement work, or how can the community engagement work contribute back to their role. Whenever it's really well done, I think those dimensions really show up. I don't have the list in front of me. So there's one, though, that I believe is about like compensated or
resourced and compensated.
That's an example of one where, man, I think a lot of organizations struggle to figure out how to compensate people with lived experience. And I think, again, this is a real thing. And so it needs to be compensated. You can't just be asking patients and people with lived experience to do a bunch of this work to relive their trauma or to give really good advice and suggestions and feedback to the healthcare system and then not pay for them for their expertise. And so I think, again, whenever it's operationalized, I think those dimensions, they show up because it's actually a part of how the organization functions and not just like a checked box.
Yeah. What do you think, Rebecca? Because I think part of the resource and compensated, I think there was an interview that said people with lived experience are asked to give their time, treasure, and trauma. Those components. I don't know if that feels accurate to you.
Definitely. And it is a process. And talking about these things does bring up past trauma. And often we do get re-traumatized through this. But it is important work. And I wouldn't trade this for the world. I want to make sure that my suffering didn't mean nothing. And if that means that I have to re-suffer in the process, then it'll be worth it to help other people. So definitely.
Yeah. The key is it's helping make an impact, right? Or making a change.
Exactly.
So trying to make sure that happens. The 9 dimensions, just to call it out for our audience, it's trust-based, asset-based, inclusive, integrated, mutually beneficial, resourced and compensated, and transformational and restorative. Hard to listen to this, so there will be a link to the report so you can read about it. I think each one has an important aspect of what it means to have real community engagement. Of those 9, what do you think organizations get wrong most often? I know we a little bit talked about the resource and compensated. Is there a dimension that organizations just repeatedly fail at?
I think the mutually beneficial and impactful, I know those were really important to me personally, and I'm sure Rebecca can add to this as well or pick out the ones that she feels. I just refuse to participate in things. I will give time and resources all day, every day. And I actually care more about the impact and the mutual beneficial part because I do not want to be a part of something that is not going to change. Healthcare is a disaster. And in America, it is a complete disaster. The systems are not, well, some people would say that they are working exactly as they were designed to work. Yeah. But our health outcomes are terrible. It costs too much. People are literally deciding between rent, eviction, the healthcare bill. They get debt collectors calling them. I don't know. It is the worst having a debt collector call you. They call you 700 times a day and they text you and they blow your email up and they send you a ton of stuff in the mail. And there's just all these pieces. And then there's racial inequities. Rural areas have very little healthcare access. I mean, there's just all of these problems in our healthcare system, right? And I do not want to be a part of something that is not going to make it better. And I'm just not interested in it because I think that I know that my time is valuable because I have a limited amount of time that my brain will function in a week. And so before it just crashes out, I'm like, I'm going to invest it in things that make a difference. So it's incredibly important to me that it's impactful. It is not a checkbox for me. I've never met a person with lived experience, a patient partner, however someone wants to refer to them, that engages in this work and that it's just a checkbox for them. It is deeply personal to us and it is deeply important that we are able to see the fruits of our labor. And so I think it's just incredibly important that there is an impact. And I would just say a highlight of one of the projects that I worked on while I was on a patient family advisory committee at a hospital was when they would come back and say, here's what we did and here's what happened because of the feedback that you all gave. And that was such a critical part. Yeah. And so I think that report back, that understanding of how you are able to make a difference is such an important piece, and then that mutually beneficial component. Because again, this is not something that we just want to do robotically. It's something that really we want to see make a difference.
Yeah.
I don't know if there was other ones that stand out to you, Rebecca.
No, the thing that comes to mind first is, first and foremost, the Inspire team has been a delight to work with. And they, above anybody else that I've ever worked with in this space, and I've been working in this space now for 25 years, understand the value of patient engagement, but walk the walk, talk the talk. We are true team members on this team, and they don't just look to us for our feedback on only as a person with lived experience. We are professionals. We're treated like they're equal. That doesn't happen all the time. I just want to give a shout out to Inspire for just being amazing to work with. And I've learned a lot through this process, and where they might be able to get better at. They're incredible tools that every organization, even if they think that they have a great community engagement, they should still take that test that's available online to see where there may be holes that they could fill.
Yeah, totally. I think of part of this, what's resonating, or I'm thinking about, is we use the word customers a lot for patients in healthcare system sometimes, and where it falls short because customers fundamentally receive services from you, and their main power is to not buy something, unlike going to a store and you just like, I'm not going to pay for this thing. But in healthcare, you don't really have that choice. So then you don't have that power, which is like not spending money because you have to use it. So customers seems like the wrong metaphor for things. I don't know if that rings true to you, but I think of how that makes it so you can't truly engage and change or really feel like your voice is centered.
Well, I think it's interesting that you say it that way, Raj, because I actually think when we think about what's happened over the last several years, there's a huge epidemic of mistrust that has always probably been there, but was like bubbling under the surface, but I think has really manifested over the last several years, right? So we look across the country as we see childhood immunizations are dropping, and my state, you have a lot of issues with getting immunizations done. And I mean, there's a lot of areas where you see that people don't want to go and get the screenings, the mammogram, the colonoscopy. Like there's a lot of cancer screenings that patients are behind in. And I mean, I think it's mistrust. Trust is a currency. And I think because maybe people don't feel like it's the same as showing up at a grocery store, I think one of the places that patients do have control is like, do they trust you? And how long is it going to take before a patient really follows through on guidance from a doctor in a system that they may not fully trust? And I think that if I'm a leader in a healthcare organization, or I'm a doctor, or I'm a nurse, or I'm thinking about the ways that the growing mistrust of healthcare in America, and I think really figuring out authentic community engagement can really help with that, because I think that while it's not like we're customers in a grocery store, people will find their ways to make sure that they register their discontent in the system that they're in. And so I think there's some obvious indicators that we have a bit of a crisis when it comes to trust. And so I think that healthcare organizations really should be figuring out how they can do this right, and just thinking about what's coming in the next year with policy around Medicaid cuts and how much that's going to impact the healthcare system as well. But more importantly, how much it's going to impact individuals. It's really going to come down to who trusts the system and who has relationships in the system. And that's going to come down to who's doing authentic community engagement, who really understands the people that they're serving.
Yeah. Do you all have any examples of it being done well, where the trust has been broken and then it's repaired through engagement? You all live in different states where trust is broken for actually quite different reasons, because the population is so different, whether it's vaccine skepticism or the political climate. You know, it can go a lot of different directions, even though the root cause could be different for broken trust. And I think for you all, probably really personal. I think of, Rebecca, you're watching cancer patients navigate a system that often fails uninsured, right? And more people are being uninsured. There's Medicaid cuts. So the broader political and policy changes are continuing to be negative. So patients keep being let down. So you have somebody who's trying to build trust in that context. So I'm wondering if you've noticed anybody doing good work, because when I've seen patient advisory councils, sometimes the problem people are trying to solve is very selfish to themselves. I want to make this process more efficiently so I can see more patients. So how can you help me do that? I've seen actually different models with that. And I want you to hear your perspective. One is there's a standing council and we talk about problems together and then we close the loops. There's also the second model of there's not a council, but one person comes to the quality collaborative meeting. So then just quality focus, but you bring a guest in there. So I've seen both models. And then we're adding in social media too. Am I missing any other ways to engage community other than surveys?
Yeah, I think health fairs can be community engagement. I think there are some focus groups or town halls, right? Like, I mean, imagine if healthcare leaders really were presenting themselves to the public in town hall settings of come and tell us what we need to do better. I think it's how do we close the gap between the decision makers and the people that they are serving. And I'm sure there are some innovative ways people are using social media to do so. But I also just think that, I guess, unique ways, and where Rebecca and I originally met was that we were part of a consumer scholar program that Camden Coalition, which is a part of the Inspire project, that they lead out on, where they take people who have a physical health condition and then some other social condition, and they categorize that as like the complex care community. So across the country, there's people all across America who've been a part of this consumer scholar program or who are currently a part of it. We were a part of it years ago. And for me, and something that really helped me navigate the system and deal with some of the trust issues that I was having, was just being able to be a part of a cohort. We were never told, you have to say this. We were allowed to have our own opinions, have our own experiences, and then talk amongst each other about how to then be involved in solving the problems, being involved in changing state laws or going to DC to work on cancer research. I do policy work myself, and we just have full agency and that we're empowered so that we're not only acted upon. It sucks whenever you feel like you're just a part of a system where you are only acted upon and you have no agency. And so being given training and a lot of leadership training that allows us to be more engaged and more empowered, I think that's really the highest level, I think, of engagement. I recognize some healthcare organizations are going to hear that and think we would never or we could never, but just recognize that there's ways in which actually empowering and building leadership and capacity building in a population that you're serving can be a way that you can improve the system. I share this with healthcare organizations sometimes. I'm like, you need to help direct some of your most frustrated people to people who can help activate them into turning them into advocates. People who are pissed off, they can change the world, you know? So it's people who are frustrated about something, like they're going to be the more likely ones to solve a problem, right? If you are on the neurotrauma floor and the lights are really bright and the noises are still really loud and you're just like, how is this a floor that understands that everybody here has brain injuries? This was just my first experience of being like, this system is stupid, because now if they turn the lights out, like there's things that they can do that they've become more aware of. But I just think times you just have to find the people that are frustrated about something, because that means that they understand it and then they can be involved in trying to actively be a part of fixing it. And I think that's a really big part of engagement that gets overlooked as well.
Yeah.
That was a really good point. And I even work with a pharmaceutical company that gathers patient advocates for a yearly conference. And the conference is based on their social media interactions. So they pay for everything. And then that same company has grants, not for people with PhDs, but for the community, community-based grants that advocates could apply to change their local communities, to empower people at home. And I think more organizations need to be doing that kind of stuff. And nothing against the big fundraiser to save the whatever or bring awareness to whatever, where these major health companies are buying $10,000, $15,000 tables. That's great. I appreciate that. But maybe a better use of that money would be to support a boots on the ground type of organization that's changing people's lives.
I love that. It's making me think of other innovative ways of doing this, because you're right. Surveys and fundraisers, annual galas. Here's the $20,000 table. Come and show up, right? I love that grants for patients to feel empowered. Any other innovative ways of engaging community? Because I feel like part of the 9 dimensions is how, I'm curious now on what people doing it and making it real in innovative ways.
I think you could turn a patient advocacy group in the hospital. You can activate that, not just a virtual meeting once a month to just talk about things. I mean, I've seen some of those patient advocacy groups and they don't seem particularly effective or engaging, but something where you're having like a mystery shop type thing where you're asking the patients to look at it not through the view as a patient, but as somebody that is visiting for the first time. What alarms you about this waiting room? What would you do to make it different, to make it feel better for you? What about these brochures that we have at the front that explain XYZ disease? How does this make you feel? Are the colors okay? Is the verbiage something you can understand? Is it too medical? Is it too jargony? Asking those types of questions helps me feel like I'm part of the team. And I wish that more medical institutions would think about asking us first before they print 50,000 color copies of something that probably cost, I don't know, $100,000 to print, and they have a warehouse full of this stuff. And I could save them so much money that it didn't need to be 4 pages. A 1-pager would have been just fine. And less jargon, stuff that's not going to go way over my head and not scare the Jesus out of me. Just make it plain language, something that I can understand and that can help others and not overwhelm somebody. It doesn't need to be flashy. It doesn't need to cost a lot of money.
Yeah, I love that feedback. How do you balance this idea of you're thinking of how does this feel for me looking at this brochure and walls, and how could it feel for others? So like you're representing a community or people that are so diverse, right? Some people might like certain colors, others don't. And I can imagine that burden. I always think of talking to people and getting their advice about something. I was like, this seems really hard. I don't know how you're navigating this.
Yeah. I would say ask diverse people because some folks are colorblind and people still put brochures out that they don't even think of that. They don't even think about people that are colorblind. And sometimes there's stuff that they can't even interact with because the most diverse that you could get, the better, because we are a melting pot and there are people with so many vast experiences. Don't just ask one group, multiple groups of different age ranges, of different ethnicities, backgrounds, experiences, just so that you get more bang for your buck of even asking. And truthfully, I've not been asked very often. And I feel like most times they really don't care how I feel in the waiting room waiting.
I think it brings like an important point that I don't actually think gets discussed enough for those of us that are on like the patient partner side as far as our responsibility. I think it's really important. To Rebecca's point, I mean, there's many times where patients are not asked or are not consulted with, but so for those of us that get the opportunity to be involved in the decision making, it's really important that we do think about our own experience, but also the experience of others. This became pretty important to me and something that I learned through the Consumer Scholar program that I mentioned a few minutes ago, because I would just hear about people's experiences from all over the country. I lived in a neighborhood at that time, was just like overwhelmingly people that were struggling. They were on Medicaid or Medicare. And I realized I needed to start asking my neighbors more questions. And you have your foot in 2 worlds, like you're straddling a line of knowing. And I felt this a lot of having to learn and Google a lot of the healthcare jargon. And I would just be in rooms. I was like, I don't know what any of you people are talking about. And so I would just be Googling stuff. And I'm really privileged to have a public health degree, which gives me some insight that I wouldn't have just as a patient. But also my life was falling apart and I was struggling. And it just changes how you see the world. And I think that trying to make sure that I was keeping a foot in both worlds, where it's in one room, I'm going to have to like feel, okay, what is value-based care? Like be Googling all these things. What is an ACO? What is like whatever. But then talking to regular people in my neighborhood, they never knew what these words, but they made more sense. They never knew what all these words meant. But when I'd ask them about their healthcare or whatever, I would just talking to them and they would be explaining something to me that they're going through. And I'd be, okay, now how do I translate this back into language that these people in this other room will understand? There's like a real thing about that. But I think there is a responsibility on us that, number one, like none of us are like monolithic. So like you're not going to find people where it's like, I cannot fully represent people with TBIs. Like there's no person that you could drill down to and say, you are representative of all these people. but recognizing why we're brought into the conversation. So when I was on my state's Medicaid advisory committee for many years, I was a consumer who was representing people with lived experience, specifically people with disabilities that were living independently. And I tried to think a lot about that whenever I would be in the meeting. And I also want poor people to be represented with dignity. I will not be screwed over by these VPs of health plans and hospitals. I'm not going to talk to you like you are better than me because I believe we are all God's children. I am not going to bow down to you. I'm not going to you don't run this room just because you have this high paid salary and your fancy names and titles. So I think you have to remember who you're fighting for and represent them with dignity, and also make sure people understand we're not all monolithic. There's going to be people who will disagree with how I show up or what I advocate for or what I push back on or what I'm questioning. And I think there can be space for that, because I think, to your point, it's not like we all like the same color on a flyer.
Yeah.
But to Rebecca's point, that is why plain language matters. That's why diversity matters, because I think it's really important that these spaces have diversity, but also realizing that there's still going to be things that fall through. But then if you have a system that is easier to engage with, then you're going to hear more pieces of feedback. And so I think it's the systems and the organizations and the healthcare partners that are just so afraid of that engagement. They're afraid of the feedback. They don't know what to do with it when they get it. Those are the ones that are going to be the hardest for people to be able to push into a better human-centered direction. And so I think it's also making sure that these organizations are moldable.
That was an excellent point at the end, too, where I find when we're engaging, when I was a director of a local clinic, I helped lead a patient advisory council, and how many things felt outside of our sphere of control. Mm-hmm. And how do you bring it back to what's controllable, but also feel like you're making an impact? Yes, that stairs in the front of our building is not accessible for people in wheelchairs, and we'll do our best to advocate, but I don't know if we'll get there. Is there something we can control right now? But then you're like, that's not what's most important to me. So you're trying to actually agenda set or prioritize and find something meaningful. And that tension exists, and there's probably not a great quote unquote right answer to this, but I'm wondering if you all have experienced that and how you've helped navigate it. And obviously, Stephanie, you're talking about big things like Medicaid policy, and that has been a whirlwind and feels so out of control, especially depending on the political climate. And then you're going down to people who are talking about, hey, I can't get insurance. So you're trying to bridge that. You're on committees, so you're seeing powers from that lens, and still it's like you're just trying to reach higher and higher to get to the power to make change sometimes.
Yeah, it's hard. I think it's Rebecca's first response in this conversation. I just cannot say how much all of us have this commitment to making a system better than how we found it. And I love what Rebecca said earlier. It is hard to hear, but there's some real truth in it. There is this willingness that we have, I think, to suffer a little bit if it means that somebody else doesn't have to suffer more later. There is just a sincerity to that I think in our capitalized world probably doesn't really make sense to people. But when you feel pain, the human need, we don't want others to feel pain. And so I think that can really root us in remembering to just keep up and keep pushing and keep pressing. And I think it's a good point, Raj. If you're a doctor and you really care about your patients, but there's not wheelchair accessibility and it's hard for your patient that's blind or anything that's difficult, or you have a patient that speaks a language that's not a common language, so it's not written everywhere and have a hard time finding a way to access information. I think there's a creativity to it. What else can I try, or who else makes this decision, or who can I push on? But again, it's really empowering people to be hey, I'm going to take my patient in the wheelchair, and me and my patient in the wheelchair, we're going to meet with the building operations. It's just how do you find the person that does make the decision, and can you be the bridge to helping connect that? And I think sometimes there can be opportunities like that. Inspired did a workshop in a month or so ago, and there's an organization from Oklahoma that I keep thinking about. They do really excellent work in engagement, and they just never stopped coming up with ideas. They were so creative, and they just kept trying to think about, okay, who are we missing at the table? And also, what else have we not thought about? And they just kept trying, and I think probably have a small budget, but they really were just really innovative, and technologically necessarily, but just human creativity of just maybe if we get these people to organize on this thing and we do this thing differently and we can have this committee do this. They just found a way to make it work, but that it's because they were so deeply committed to recognizing that the only way they were going to get the outcome that they wanted was through genuine, real, people-powered engagement. And I think that is what motivated them to keep trying, because they saw it as deeply connected to the outcome that they were seeking. And I do think sometimes the thing I need to change is going to require all these people to be involved. And so you just keep pressing and keep trying to recreate something if something doesn't work. And it seemed to work really well for them. And I've been inspired by their example because it was just very relentless with their pursuit of trying to find the path to make sure that they're doing the kind of engagement that they needed for their work.
Yeah.
Yeah, you use the perfect word, relentless. That's what you have to be if you're going to do this work. You have to be relentless, resilient, and you get kicked a couple of times and you just get right back up. There's losses, there's wins, and it's a long road. And I say, bring it. I'm up for it.
Thank you.
Yeah, we come cancer twice, Rebecca Hines. You're like, this is nothing.
I got this.
Yeah,
Well,
you do.
Thank you. You all inspire me. Thank you for doing this very hard and important work. And just this idea of, it's almost like a sacrifice. I know I have to suffer a little to make it better for others. So thanks for just doing that. That's hard, I know, and I want to acknowledge that. And a plug for the Community Catalyst created the Inspire, which is the roadmap for effective engagement in healthcare. I'll put in the link in the show notes. Any other final words, Stephanie and Rebecca, before we end the episode?
I encourage any organization out there that has direct work with patients, people with lived experience, complex health issues, to go to that website and take the practice profile test and see where you rank. You may be surprised by some of the things that come back, and it may highlight some things for you to work on. Just by taking the test shows that you have a great heart.
After you take the test, make the changes.
The tool really is, just like to give it a final plug, quite accessible. Like Rebecca said, if people take the assessment, it allows you to assess how your organization is doing with community engagement. And then it really does organize whatever your rating is, then gives you the right tools to meet where your gaps are. And it gives you like low-hanging fruit, and it gives you things that might be more of a reach. We recognize some people are just going to want the low-hanging fruit, and we get that, but it's going to give you both. And then it gives you the variety of information. So it might give you a little audio clip of people talking about how they made it work in their organization, or it might give you a checklist that you can follow through to operationalize another piece. But it's really about operationalizing community engagement so that ultimately we can get to that outcome that I think we all are aligned on.
Thank you so much. As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized, topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.